Hello everyone, I hope and I believe you all are doing great. This is Dr. Arya, your pathology faculty. Today we will study a very important topic of pathology, that is your emphysema. And in emphysema, you will get it as a short note. Okay, you will get it as a short note. So let's study what it is. See, emphysema is basically a chronic obstructive lung diseases. Okay, you have two type of lung diseases. What are they? They are nothing but you have the obstructive one, then you have the restrictive one. So emphysema is basically a chronic obstructive disease characterized by a permanent enlargement of air distal to your bronchioles. Okay, so your air bronchioles are basically getting dilated, or you can say are basically getting enlarged. As a result of which what happens? Your alveolar duct and your alveolar sacs also get expanded. Okay. What is the epidemiology? So this disease mainly peaks at the age of 40 to 60 years and it is strongly associated with people who are smokers. So in the history, when they will give you a case scenario, they will mention that this person is a middle-aged man and he is a chronic smoker. Next, so male is to female ratio is narrow. Okay, and you have a very important thing in it called as your alpha-1 antitrypsin deficiency. And I have told you about this in your journal pathology. Next, what are the risk factors you have? First risk factor is your smoking. Smoking is also the most common risk factors. Now, what are the causes of it? What causes it? What happens when a person smokes? After some times, what happens is there is recruitment of neutrophils and macrophages, which finally releases the protease. Okay, protease is what? Protease, EAS. Whenever this terminology comes, you should think that it is an enzyme. Now what happens? There is oxidative stress. There is oxidative stress. As a result of which what will happen? There will be epithelial injury. Epithelial injury. Okay, so this is the mechanism when the person is a smoker. These all things can happen. Now you have the genetic factors. In the genetic factors, you need to remember one only, that is your alpha-1 antitrypsin. What happens? Alpha-1 antitrypsin, your alpha-1 antitrypsin basically inhibits the neutrophil elatase. As a result of which there will be deficiency of the elatase, and what will happen? There will be alveolar wall destruction. Okay, there will be alveolar wall destruction. I hope this much is clear. Then you have the environmental exposure. Obviously, if the environment of that person is dirty, if there is so much of AQI, you know what is AQI? That is your air quality index. Like in Delhi, it's very, very high. And during the Diwali season also, the AQI is very, very high. Okay, so AQI also contributes the air pollution, the dust and the occupational fumes, like the fumes which comes out from your factories, right? Next, let's talk about the pathogenesis. What is the pathogenesis? First, what happens in normally, if I talk about the normal lungs, normally what happens? There is protease. Then what will happen? they are basically released in control and they are checked by the anti-proteases. Like when we were kids and when we have exams approaching nearby, so our mother used to keep a check of all the things that we are done with this subject, and this much portion is left. So we are in a normal stage. Now what will happen? The person now get admission into the MBBS, right? So what happens? In the first year, they will take a exam very seriously, but from second year onwards, they will start misbehaving and they will not take the exams seriously. So what happens? There is increased level of protease, okay? Increased level of protease. Protease is nothing but the masti that we all do during our MBBS. So there is increased level of enjoyment, increased level of excitement, right? As a result of which we are not able to study more. So there is decrease in the anti-protease activity. And what will happen? If there is anti-protease activity, what will happen? There will be alveolar wall destruction, okay? There will be alveolar wall destruction. Next, what will happen? There will be oxidative stress. How the oxidative stress comes into the role? See, what happens is when the person is a smoker, after smoking, what happens is there is a activation of reactive oxygen species, as a result of which there is alveolar epithelium damage. There is damage to the epithelium layer of the alveoli. Okay. Next you have certain inflammatory mediators. What are the inflammatory mediators you have? You have the TNF alpha, you have the TNF alpha, then you have the interleukin-8, then LTB4, right? So what they all do is they recruit the neutrophils. And they maintain the chronic inflammation Right, see this figure. In this figure, you are able to see all the factors, that is smoking, then alpha-1 antitrypsin deficiency, then you have the decreased antiprotease, then there is elastic damage, and there is increased protease, which leads to the emphysema. So this is the whole stem. This is the everything that emphysema needs to occur. Okay. Lastly is there is loss of elastic recoil. So if there is loss of elastic recoil, what will happen? Firstly, there will be disruption. I don't know why I am saying disruption. It's destruction. Okay, it's destruction of elastin, as a result of which the elastic coil gets reduced. See, now you bought like in our childhood, what we used to do is we used to take a toy, and in that toy you have a spring, and you just pull that spring very much. After some time, after 2 to 3 days, what will happen? The elasticity of that spring will get loose, and similarly this happens in your alveoli as well, which will lead to what? Which will lead to the trapping, and hyperinflation. Okay, the spring was earlier this much. You just keep on doing this move with the spring, so the spring length will become this much, right? Same goes with the alveoli. Now, next thing that I want you all to understand is about the morphological type. And if the question on emphysema will come, you have to make this table of morphological changes, right? First one is the Centriacinar. What does Centriacinar means? The term is also suggesting in the center. The site is in the either the proximal or the distal. Associated with smoking, chronic bronchitis, and most common in your upper lobules. Okay, it is most common in your upper lobes. Okay. Then you have the Panacinar. It is the entire acinus is involved. The association is with the alpha-1 antitrypsin deficiency, and it mainly occurs in the lower lobes of your lungs. Next you have is the Distal-acinar. In the Distal-acinar, it is located in the distal acini and is spontaneous and pneumothorax in young children. It is more severe in your upper lung zones. Okay. Then you have the irregular one. In irregular one, what happens is the site is irregular and is associated with the scarring and is usually is incidental. And what I want you to tell is it's mostly asymptomatic. Mostly it is asymptomatic. So these are the things which you need to keep in mind while writing the answer of your emphysema. Next, if in your practical they give you this beautiful picture, then you have to identify it as the case of emphysema. This is the cross image of emphysema. The lungs are large and voluminous, overinflated, pale and fluffy. Then they may overlap the mediastinum and apical bulla are prone to rupture. And in the microscopy, although you are not able to identify it, but what you are able to see, you will be able to see this. You are able to appreciate what? There is a lot and lot of alveolar space. There is lot and lot of alveolar space which is there. Then what happens? This. What is this? This is thin and destroyed alveolar septa. The capillary cells over here, the capillary beds over here are reduced and there is no significant fibrosis. There is no significant fibrosis. Let's see the physiological changes. In the physiological changes, we all know that there will be decreased in the elastic recoil. Just we have seen the example of your spring. So as a result of which, what will happen? There will be obstruction of airflow. After that, what happens is there is increase in the compliance. There is increase in the compliance and there will be air traffic, hyperinflation and the barrel chest. Guys, it's very important. It is a keyword of your emphysema. Okay, one more thing guys that I want to tell you is whenever you read a topic from your university exam point of view, just try to highlight certain keywords, so that will be very essential for you at the end of your exams. Okay, so in this you will be having a barrel shaped chest. The DLCO level of this is usually decreased. What are the clinical features you have? First one will be, there will be dyspnea, that is progressive, severe and insidious. Cough will be mild and there will be scanty sputum. Scanty means it will be in little amount, not in a very huge amount. There will be weight loss and muscle wasting. There will be barrel chest. And barrel chest, guys, you know what happens? There is increase in the antero-posterior diameter. There is increase in the antero-posterior diameter and there is prolonged expiration. What is inspiration? The process of intaking the breath. What is expiration? The process of exhaling the breath. Okay. Then you have a tripod position. What is tripod? Tripod means a sitting and a leaning position, and it is also a developmental milestone. You will learn this in your pediatrics. What happens is that the person will sit like this. Okay, leaning forward, because it's very easy and convenient for that person to take the breath. He will not sit like this. He will sit leaning forward. Okay. Now, you have something called as pink puffers. What are pink puffers? In pink puffers, the lips are usually thin. Okay, they will have like this, will be like the lips. Okay, just like your pink lips, their lips will be pink and thin and it will be like a pursed lip breathing. Okay, then there will be hyperventilating, dyspnea will be there and cough is minimal. there will be late hypoxemia and late core pulmonale. Then you have something called as a blue bloaters. What are blue bloaters? Blue bloaters are nothing but there will be cyanosis. And you know guys, obviously if there will be cyanosis that is taking place in that person's body, what will happen? There will be bluish discoloration of the body. And cyanosis is of two types, either the central one or either the peripheral one. Okay. Next you have is the obesity and edema. What are the complications that this person can face? The complication can be, first one, there can be respiratory failure. First one, there can be respiratory failure. Second one, there can be pulmonary hypertension, which will further leads to a core pulmonale condition that we will study later. There will be recurrent infection and there will be pneumothorax. What is pneumothorax? There will be rupture of bullae, especially the parasternal type. Okay, paraseptal type. What are the investigations you will order? In the investigation, the very first one, that is your gold standard, is your spirometry. And I guess guys, if you ever visited to your ENT posting, there you will be able to see the spirometer. Okay, and even in your medicine posting also, you will be able to see spirometer. So it's your homework. If you have not seen a spirometer live, you have to see it by tomorrow. Okay, then there will be decrease in the FEV1 and FEV1 by VC ratio. Okay, then you will order the chest x-ray. In chest x-ray, you will be able to see hyperinflated lungs. There will be flattened diaphragm, vertical narrow tubular heart, and there will be increased retrosternal air space. Then what you will order? You will order HRCT, that is high resolution computed tomography. This is also a gold standard. This is a gold standard for what? To know the subtypes, to know basically the subtypes. That shows the area of low attenuation with the visible walls. Then you have the Centriacinar and the Panacinar. In the Centri one, you will be able to see the focal lacunae in the upper lobes, and the Panacinar you will be able to see diffused low attenuation in the lower lobe. Here you will be able to see in the upper lobe. See, wait, just let's just clarify it. You have the lobes. If it is in the upper one, either it can be on the lower one. So if it is in the upper one, it will be the Centriacinar. In the lower one, it will be Panacinar. If you are not able to remember, C is the alphabet which is third. So C comes earlier than P. Okay. Treatment. What is the treatment that you will give? The very first treatment should be obviously the lifestyle modification. Then, if the person is smoker, you will ask them, don't smoke. There, which should be smoking cessation. Then, avoid air pollutants, like avoid going to that time when the AQI is very, very high. If it's not necessary, try to wear the mask, right? Then you have the pulmonary rehabilitation. In the pharmacological management, what you will give? You will give the bronchodilators, that is beta-2 agonist, like your salbutamol, like your inhaled corticosteroids, and like your theophylline. Okay guys, so we are done with this small cute little topic of emphysema. If you are having any sort of doubt, please feel free to DM me. Please feel free to ask me. Okay, thank you so much.